Welcome to H&HN Daily. I'm Susanna Hopsalarin, Senior Editor for Hospitals and Health Networks magazine. A recent RAND Corporation study cites EHR technology as the leading cause of physician dissatisfaction, emotional fatigue, depersonalization, and lost enthusiasm. Many EHR systems within health systems are fragmented, requiring multiple logins and access points for clinicians to access patient data, causing delays in patient care and decision-making. The Penn Medicine development team created an app with clinical users in mind to access real-time patient EMR data on smartphones and other mobile devices. Today, I'm joined by Vasi Sivasegaran, Senior Director of Core Infrastructure, and Rich Urbani, Application Architect from Penn Medicine in Philadelphia, to discuss the mobile EMR data review tool. Welcome, Vasi and Rich.
Thank you. Thank you, Susanna.
It's a pleasure to have you here today.
Thanks for having us.
Describe the communication barriers that clinicians were experiencing with each other and with the patient that led to the development of this tool.
So I think the primary initiative behind this tool was the CMIO's desire to get rid of a lot of the paper that was involved. And the problem with paper is there's only one copy of it, and it's out of date very quickly. So, as I'm doing my rounding, I'm taking notes that no one else can see because I wrote it on this piece of paper instead of putting it into a system where everyone can see it. So his desire was that if they could do this while they were walking around, in between rooms or whenever they had a second from their mobile device, then everyone would see the same data at the same time, and they would all be practicing from the same page.
Yeah, absolutely. And if I could add to that, one of the examples that was brought to our attention is you have a physician who literally walks across the hospital to the other end, and by the time they got there, they just realized the patient has gone to get their radiology image done. So they just wasted the 20-minute walking over there. Meanwhile, if they had a tool available on their mobile device that they could securely access that information real time, they could better plan their routes, better plan their day and their activities. And it's all about improving efficiency and optimizing the whole clinical care workflow.
How does this EMR data review tool work?
So it's a mobile web app, so it's not a native app in that it's not something they have to install. It just works in any browser on any mobile device or a desktop.
So this tool now allows the physician to take back some of their time, to be more productive, to spend more time with the patient. And how did it change the interaction with the care team and handoffs? Did it improve that too?
I had the opportunity to round with Dr. Sue Aaron, who is the Associate CMIO, and she's been really the champion for this project, and she's who my team has worked most closely with. And she's the one that spent untold hours, helping us tailor the app to be exactly what she wants it to be. But so one morning I rounded with her and, her residents and her medical students, and just seeing all 6 or 7 of them all looking at exactly the same data, and all, one of them's focusing on the meds, one of them's focusing on the labs, and they're all looking at the same data, and they all have it real time right there. And it really does let them more quickly, get to the salient pieces of information that they need to talk about before they go in and talk to the patient. And the other thing that amazed me was when they did go in to talk to the patient, they were able to show them, here's a graph of your vital signs or your lab results, to make it meaningful to the patient so that they can see, yes, this result is going down, you're improving, or this isn't doing what we want it to do, here's our next step. And it really brings it home to the patient because they see exactly the same data that the physician sees.
Yeah, and if I could add to that, if you think about the duplication of efforts and the long delays waiting for information, so a physician no longer has to contact somebody and say, hey, was a meal order placed, or was a radiology or lab order placed? They have that information real time, and everybody's looking at the same page.
What is the impact of this tool on physician and patient satisfaction?
As we discussed a little bit earlier on, sense that every minute we save in a physician's day I think that's a tremendous satisfier for them, makes their jobs a lot easier and more streamlined. But from a patient perspective, I could just imagine just as a sick patient who's in pain, seeing that physician even a minute earlier would make my day a lot better. I think ultimately improves the patient satisfier scores.
And I know some of the enhancements we have planned directly target the patient and the physician relationship. For instance, we want to be able to have the physician show the patient a picture of everyone on their care team so that they know who their attending is and who the neurologist is that will be coming by, and so that they have a face to go with the name. We also want to build a view kind of their care plan that we can show to the patient and show to the patient's family so they know, okay, here are the top 3 problems that we're working with. You know, they're seeing basically the same data that the physicians are seeing, but in a format that's tailored to the patient.
It's a great way to create that connection.
Right.
Yep.
Thanks for joining us today.